Depression is one of the most common mental illnesses in the country, affecting almost 21 million adults each year, according to Mental Health America. Treating the disorder is difficult for many, but in West Michigan, alternative treatment options are on the rise. Fox 17's Waleed Alamla joins us in the studio with more. And Waleed, we're talking about ketamine here, which many people may hear from news reports as a drug that's been abused.
Yeah, that's right, Josh, but it also has its benefits. I spoke to the brain powers at Lifeline Intervention Therapeutics about the life-changing effects of ketamine, a dissociative anesthetic that is being used to treat depression, substance abuse, and even helping soldiers suffering from PTSD.
Danielle Dykhaus has lived with mental health struggles for years now.
I had already been to Cleveland Clinic, Mayo Clinic, I had had shock therapy. Nothing was working.
Now at her lowest moments, she turns to an alternative type of care in the form of ketamine.
After the first infusion, my suicidal ideations were gone. Just that day, as soon as I left.
Ketamine treatment is not something that's new to West Michigan, but Lifeline Intervention Therapeutics takes those extra steps.
Psychiatric care often is not available at some of the clinics in the area. There's no psychiatrist on site. We have one on site. We offer full psychiatric medical management.
And having a psychiatrist in-house ensures the patient is right for ketamine, which has had a negative reputation.
And overcoming the stigma of it it's not helpful when things like Matthew Perry happen, right? When it's administered properly and given in the right setting, we don't send people home with it. We give it here in the office, that it's safe and it's effective and it helps.
Having individuals who care is important, especially when dealing with those who have served our country.
Many of the veterans that come back are so severely traumatized by what happened, and the PTSD that they have is so significant that the depression that comes along with it, they can't even really differentiate between the two.
Which is why patients like Danielle see the benefits.
You don't have to have tried everything that I have. You don't have to have tried shock therapy. You don't have to have tried, everything. But I don't have to be on a whole handful of medications anymore, where I used to be on 4 or 5 plus a benzodiazepine.
Ketamine is not FDA approved to treat any psychiatric disorder, but back in July, Johnson & Johnson did seek approval for a nasal ketamine spray that is currently in waiting. For now, reporting in the studio, Waleed Alamla, Fox 17 News.